today we're going to be looking at something that affects most of us to a certain level. It might not affect you directly, but you know someone that it affects. Today we're looking at sex enhancers. Everybody wants to last. Everybody are putting in effort to last. You go around the street, you hear people, I want to last, I want to last. Men want to last, women want to last. So let's see how well you can last.
Sex enhancers, it's quite a complex one, not too complex, but then it has been a menace, both a blessing and a menace. What people would go for when it comes to sexual enhancers would be the longevity. That's how long they can last. That's the potency part of sexual enhancers. And most times when they go for the potency part of sexual enhancers, they get the wrong ones. Let's take, for example, tiger nut. Is a very good natural sex enhancer. Do you know the funny thing? I didn't even realize that tiger nut is a sexual enhancer till I served in the north. As you're in the midst of your friends and then they are bragging. I go 2 hours. Which normal human being goes 2 hours? Are you jobless?
My neighbor.
Exactly. Like a normal sexual activity should last you for 5-10 minutes. Medically proven. For every time a guy reaches climax and orgasms, it's the same. It is equivalent to someone running around a stadium. How many times? Have you done your research? So by the time you are orgasming, you reached orgasm the first time, you reached the second time, and you are shocked why you no faint. Why would you faint?
Na marathoner.
You now mix milk, you mix more. It's not giving you nothing. It's giving you nothing. It's not supplementing anything for you.
Yeah.
Because you've not done more than the people that are even contesting at the Olympics. Like, why?
Yeah, I think that's what people don't know, that as a man, your cardiovascular system is hinged to your reproductive system.
True.
You have an erection because blood is being pushed into your penis. And when blood is being pushed into your penis, it means that to a certain level, there is a shortage of blood that is flowing to our part of the body. So your heart has to compensate.
Oxygen is not even reaching the brain. Like hypoxia. Then you get into shock and then you slump. Nobody slapped you.
So basically,
slapped you.
That means that your heart is compensating.
True.
That's why if you're having sex, if you can take out the time, just touch your heart while you're on the process.
Man.
It's going to be as if you're running, as if you're going on a radar. I don't know, for someone like me who's played sport and I have to run around, I don't think that's enjoyable. So I don't know how. It's always enjoyable at the beginning, but if you keep sustaining it, it leads to, because, with the stressing of your body, lactic acid is produced, it starts bringing pain. And that's why you're hearing people dying on top of women.
Yes, definitely, it happens.
Yeah. So what is some lifestyle that could, should I say, enhance or, boost your sex performance, or help you at least to stay the way you should be and not decline? Hello, everyone. Thank you for joining us once again on the Intimate Matters podcast. And on this podcast, like you should know, we take you on a deep dive into the world of sexual and reproductive health. We tell you what you need to know. And also we try to explain and expand on what you already know. And today, just like every other episode, I'm here with an amazing personality. I'm here with a pharmacist, Farm Blessing. Thank you for joining us today.
Thank you. It's a pleasure being here. And thank you for having me on your podcast.
Oh, that's a nice one. So today we're going to be looking at something that affects most of us to a certain level. It might not affect you directly, but you know someone that it affects. Today we're looking at sex enhancers. Everybody wants to last. Everybody are putting in effort to last. You go around the street, you hear people, I want to last, I want to last. Men want to last, women want to last. So let's see how well you can last. Let's see what you need to know about lasting and what is actually lasting. So Farm Blessing.
Yes, please.
Take us into sex enhancers. What are sex enhancers?
Sex enhancers, it's quite a complex one, not too complex, but then it has been a menace, both a blessing and a menace. A blessing in the sense that it has been able to help with the original intent for which it was formulated for, which is having to address sexual issues like we have erectile dysfunction, we have, premature ejaculation, and all of that. Then a menace, because a lot of persons have been abusing sex enhancers. And it's worrisome because coming from the younger generations that feel that lasting beyond 5, 6, 7, 8, 10 minutes is what is now termed as a proper man, or is now a characteristics of manhood, as we would classify. Now, for sex enhancers, I like to categorize them into 3 most times, especially in clinical setting, because when we give sex enhancers or we have sex enhancers dispensed, we have them with 3 things at the back of our mind. One of which is to help with libido. Libido is sexual desire, sexual longing, an ability to be attracted to a counterpart and also express that sexual desire and ability. We also have it in for potency rather. Potency is the ability for you to sustain and maintain erection and also to ejaculate. And then we have the last one, which I think most persons use it for, which is sexual pleasure. And that's where your aphrodisiacs come into play. So people want to feel the act while they are in it. So we have sexual enhancers as both the ones for libido, the ones for potency, and then the ones for pleasure.
All right. So you're trying to say that we have the ones you go to increase your urges, and
Yes.
there is a one you need to take to be potent, and then there is one for pleasure.
Sure.
So sometimes I wonder which one people are actually after. Is it that they want to, they want to increase their urges?
Now that's where the problem is, because most persons don't even know what they want. So they just hear that they are sexual enhancers. And most times what people would go for when it comes to sexual enhancers would be the longevity. That's how long they can last. That's the potency part of sexual enhancers. And most times when they go for the potency part of sexual enhancers, they get the wrong ones. The popular ones we know in the market have their different mechanism of action. So your friend took, we're not allowed to say brand names here and, medication names, but your friend took a particular sex enhancer because he had, or maybe did not even think he had a need. And then you heard the story and you also went to get yours. Now, what happens is that these 3 classes of sexual enhancers have their different mechanism of action. For the ones that dwell on libido, what they do basically is that they increase serum testosterone level. And what this would do in turn is that to help you have the sexual desire. I mean, how do I know that this works? Research have been done in hypogonadal men. That's men that have, lesser level of testosterone that is responsible for the whole masculine feature and all of that. So the ability for these researchers to have a testosterone replacement therapy for these hypogonadal men is where we now have testosterone given to these people, and we saw that they now have increased sexual desire and pleasure. Okay. Right? Now, for the other ones, that's the one that has to do with potency, that has to do with erection, that has to do with ejaculation. The pathway for that one is different from this other one. So what this one does is that it helps with, nitric oxide, excretion. So when you have nitric oxide in circulation, then there is a relaxation of your penis, that's your male organ, and then blood can flow. So because blood is flowing, you have sustained erection. That's a different pathway. Now, the primary reason why that one was formulated was for people that had erectile dysfunction. Now, I want to ask you a question. What is a young adult or 25, 30 doing with such medication?
He feels that his erectile function is not functioning as it should function. So
when he's 65, what will he now use?
He'll borrow from his neighbor. So because basically, thank you for saying that, because it's a thing that people do, where people, because someone is using it, they also get to use it. I remember a story a friend of mine told me where she went to a significant other's house and went and saw some drugs and started questioning him about it. I was like, no, it's not mine. I keep it for my friend. And I wonder if drugs like that is something. So I was asking her, did you ask him why the friend couldn't keep it for himself in his own house and had to come keep it here? But I also feel that peer pressure is also an issue. The way people have come to make sex more or less a performance-based activity, if I should say that.
Don't call it metal.
Yeah. So you go around where people are discussing sex, they're talking about how many rounds they can go and how long they can last. Okay, so we'll really come into that, because oftentimes we know that when abuse comes to play, a whole lot of things also
Definitely.
come to play. But let's talk about natural enhancers, right? Because some people will say that they don't take what we call the drugs. Like that one has so many side effects, but I only do natural and the rest of the stuff. So how about natural enhancers? Does it work?
I'll answer your question, but first off, let me see what we usually see normal practice as pharmacists. All drug, all medication is a potential poison. The only difference is the dose. So whether you take it natural, whether you take it conventional, right? What matters is the dose. And one thing people do not understand is that most medications are actually gotten from natural sources first. Then we now synthesize the active ingredients responsible for that action before we now formulate, and then you have what you call your medication. Let's take, for example, tiger nut is a very good natural sex enhancer if you consume it in the appropriate dose. Now, the whole of tiger nuts is not responsible for this action, right? There is something responsible for that particular action. But because the active ingredient, that's whatever is responsible for this action, this sexual enhancing action, is not isolated from every other component of tiger nuts, right? You now take all of it. So both the ones that are bad, but the ones that are good, you consume everything. So in as much as we're saying, in as much as you are avoiding the conventional or medication, the ones that come in tabs, the ones that come in syrups, the ones that come in whatever dosage form they come in, I think you're still doing yourself more harm, because again, it's not all of it that is responsible for this action. So yes, they are natural sex enhancers, natural product you can take that are sex enhancers, but then why do them disproportionately when you can have medications given to you after you've been assessed to need these medications? I don't know if you get what
Okay, I understand.
Just like the common enema we take,
Okay.
where I'm not disputing the fact that enemas are not good or are good, but then you take the whole leaf, you pound it, you strain it, you have the water, you have it, into your body. But it's not all of it that is responsible for that particular action you're doing. So what pharmacy does, or modern medicine does, is that it helps you with drug discovery, drug formulation, drug synthesis. So we isolate the active ingredient responsible for this action, add it up, bulk it up with what we call excipients, and then we formulate them in acceptable dosage forms, and then we give it out there. So that is why, in as much as you're saying is natural, what's the dose? Can you measure the dose? So, like I said before when I started this particular conversation, all drug, natural, conventional medication are poisons. They are potential poisons. What makes this one not a poison is the dose. If I give a person 0.125 milligram of this particular medication, if I shoot it beyond that, even by 0.1, it can become a poison for that person. It could shut that person down at that point. So how do you measure the dose for what you call natural sex enhancers? So yes, they are, but then please take them with precaution.
Okay, all right, because you mentioned something. Could this be why tiger nut is getting very expensive? Because I remember growing up, you just come back from school.
Do you know the funny thing? I didn't even realize that tiger nut is a sexual enhancer till I served in the north. Right? Now, usually they will come like that when they have health issues, prostate issue and all of that. And then the next thing is they would tell me as the pharmacist that, they would take this and they would take that. I discovered date as well. I discovered the jingo as well. I discovered a lot of them. And I'm like, talk to me.
I have a proposition that there's a reason why the top and the bottom part of Nigeria tend to be known, to be, should I say, I don't want to make it look somehow.
Exactly.
But people know they say they function better sexually. It's because of basically two things. Mm-hmm. I feel the nut has a whole lot of nuts.
No, they do. They
right?
do. Definitely.
Now, and nuts are known to be very good at boosting libido and the rest.
Sure, they do.
The South have a whole lot of fish life and water life.
Exactly.
And most of these fishes are known to be aphrodisiacs. So we're looking at just being privileged to be in an environment that has things that could boost. I like you for pointing that out, because this is not just an issue of sex enhancers. Mm-hmm. Drugs as a whole.
Sure.
People ask that question. right? Why do I need to go to the hospital to buy drugs? So for example, you see people say things like, maybe they were looking at the, drug literature and they say that maybe this thing is made of, for example, let me give an example, bitter leaf, right? Or maybe there was a bitter leaf extract. They would tell you, so why should I have to buy this bitter leaf extract when I have a bitter leaf in my
Forgetting
backyard?
that they're like standard procedures.
Yeah,
for which they're
forgetting that
extracted.
dosages is important. And I think this is something I tell everyone when they ask me about natural medication.
Sure.
I tell them that in as much as medication is okay, if we can formulate these things and put it on a
Exactly.
dosage regimen
For you.
by weight, by age, or whatsoever they want to do, that this is the way it's going to be. So please, for those who are taking natural stuff, know that anything taken out of proportion can also become a problem. Please take it little by little, because if you try to take it out of proportion, you're going to increase the market value, and common people like us, we cannot afford it. So please have mercy on us and do it that way. So going down to the enhancers themselves, are there ones that anybody can take, or can somebody just want to take anything? Should it be like that? Can anybody just walk in and pick up something and say, I want to enhance myself? Or is it supposed to be something that is prescribed for you and the rest? Because I've had people go around, and most times, like you talk about, you see young people, you check their pocket oftentimes. And
the popular one, which we don't want to
mention. Yeah, you see it in their pocket. So is it that these are things you can just buy over the counter, or that prescription? Or are there ones that are over the counter and there are ones that are prescription?
Well, we asked this question prior to. And I told you that, yes, they are over-the-counter medication. That's the OTCs. And then we have the prescription-only medication. Now, the difference between the both of them is that one, that's the over-the-counter medications, are probably procured for selfish reasons without any medical condition anybody's treating. It's basically for pleasure. I already told you that sexual enhancers are divided into three. So we have the ones for potency, libido, and then the one for pleasure. So most persons that go there go because of the pleasure. Now, forgetting that these sexual enhancers have their different pathways, their mechanism of action, how they act, where they act, what they're supposed to do. Now, for the prescription-only sex enhancers, when they are prescribed with a medical condition on the back of the mind. There's something the prescriber is looking out for before prescribing. Let's say a couple walks into the hospital and there's issue of infertility. And after running tests for the female, running tests for the male, the physician discovers that, okay, probably there's issue with the sperm of the male. Now, you would trace sperm production to where? Probably the thesis. You trace from the thesis to what? The testosterone level. And now, at the back of the person's mind, if I increase testosterone production, I'm able to solve this problem. So the person has at the back of the mind a problem to solve. You move on again to the one that cannot sustain erection. What is the problem? Now, I already said that when it comes to the one that has to do with sustaining erection, that's the potency effect of it, we have the phosphodiesterase inhibitors. Now, the phosphodiesterase inhibitors, which are one of this class of sexual enhancers, would allow for nitric oxide to be produced. When we have nitric oxide in circulation, there's relaxation, there's blood pumping into the penis. Now, what if there was a problem at that site of binding?
Okay.
The person prescribing it is having at the back of their mind again that something could be wrong at this active binding site. What is happening there? If I do this, if I block it from here, if I block it from there, I have this produced, and then I'm able to achieve, erection. The person comes and is complaining, I can't sustain erection for too long. The person has something at the back of their mind. For sexual pleasure, another thing, that's the place of hormone as well. The dopamine is there, the serotonin is there. So we have different classes, the serotonin, reuptake medications, we have the dopamine. So the prescription-only medications are with medical issues at the back of the prescriber's mind. But for the one walking into, unless you're a pharmacist, you're a medical doctor, you're a nurse, you're a healthcare professional, we still need the collaborative effort of other healthcare professionals. You're not going to self-diagnose yourself in isolation, which is not allowed in clinical practice, which Now, Except that is the case. You are walking in and you are saying, well, I want to get this for my client. I want to get this for my patient. But you, as a young guy, nothing is wrong with you. There's no erectile dysfunction. There is no, in fact, let's even go back to the issue of erectile dysfunction.
Okay.
Because I've come to realize that erectile dysfunction for a young person most times, if it is not helped trace, there's no hormonal problem, there's no issue with the penis, the muscles, everything that's involved, then there's a mindset problem. You just finish saying it.
Yeah. Because I wanted to come to that, because when you say someone is having erectile dysfunction.
Exactly.
Now, because there are people that feel, right, maybe compared, because when somebody comes to me and say, I'm not lasting, for example, maybe just call me and be like, I'm not lasting. So I'm asking the person, you're not lasting on the basis of what? What's your yardstick for not lasting?
What's the range?
Yeah, what's the range and what's your yardstick? Because some people feel that they should get to a certain level, which we know that people have individual differences. For example, I tell people that it's just like your appetite, right? People eat food differently.
Exactly.
Right. So looking at somebody who is, in quote, a foodie eating, and you feel that one cup of Gary will be okay. You should eat 10 cups of Gary because someone is...
So you should go and take appetite stimulant. It's still the same menace that appetite stimulants are causing. Because you see someone eating as much as binge eating, and you eat like healthy proportions and you are trimmed and okay. I see someone like obese on the... they say it's now thick gang. Someone that is thick, and you feel like there's something wrong with you, and then you go buy appetite stimulant and you start having this moon shape because you're having water retention, which is a side effect of these steroids that they consume in place of appetite stimulant. So it's the same problem with these sexual enhancers. You're in the midst of your friends and then they are bragging. I go 2 hours. Which normal human being goes 2 hours? Are you jobless?
My neighbor.
Exactly. Like a normal sexual activity should last you for 5-10 minutes. Medically proven. Any other thing you're doing, please, it's like you don't have a boss to report to. You don't have a job to go to. Do you have a life?
I'm my own boss. So I can stay and do.
What workers? I remember.
But that's the truth. She's saying in there that although you may not have any way to go to, you're not supposed to push this to the extreme. Because I feel, like I keep saying again, the fact that whosoever did that alteration to change sex into a performance-based activity, and you come around and people are doing grading cards for something shouldn't be. So you go around where people are discussing and people are saying, like, do they even realize, because we should say this, do they even realize the role they are had, especially for the men?
It's an exercise.
Do they realize the role they are had, how much what they do sexually affect their heart? Do they realize how much their cardiovascular system and their cardiovascular health is?
Do you know that for every time a guy reaches climax and orgasms, it's the same. It is equivalent to someone running around a stadium how many times? Have you done your research? So by the time you are orgasming, you reached orgasm the first time, you reached the second time, and you are shocked why you no faint. Why would you faint?
Na maratona.
You now mix milk, you mix more. It's not giving you nothing. It's giving you nothing. It's not supplementing anything for you.
Yeah.
Because you've done more than the people that are even contesting at the Olympics. Like, why?
Yeah, I think that's what people don't know, that as a man, your cardiovascular system is hinged to your reproductive system.
True.
You have an erection because blood is being pushed into your penis. And when blood is being pushed into your penis, it means that to a certain level, there is a shortage of blood that is flowing to our part of the body. So your heart has to compensate.
Oxygen is not even reaching the brain. Hypoxia. Then you get into shock and then you slump. Nobody slapped you.
So basically,
slapped you.
That means that your heart is compensating.
True.
That's why if you're having sex, if you can take out the time, just touch your heart while you're on the process.
Man.
It's going to be as if you're running, as if you're going at a rate. I don't know, for someone like me who's played sport and I have to run around, I don't think that's enjoyable. So I don't know how. It's always enjoyable at the beginning, but if you keep sustaining it, it leads to, because, with the stressing of your body, lactic acid is produced, it starts bringing pain. And that's why you're hearing people dying on top of women.
Yes, definitely. It happens.
Yeah, dying on top of women, especially when you use enhancers that are not prescribed to fit you. And sometimes when you want to do more than yourself, hopefully we stop to use these enhancers by ourselves. Because you can use enhancers when you have need to use it, but going in there and getting it for yourself, it's something you shouldn't do. So let's look at lifestyle. Because
Okay.
basically we've had people who, to a certain extent, are adverse to drugs, right? And I also believe that lifestyle is more or less like the first step in taking care of yourself,
Sure.
staying healthy.
Sure.
Because why, apart from some genetic causes or things you were born with, why get yourself into trouble to look for help when you could have avoided the problem from the very beginning? So what is some lifestyle that could, should I say, enhance or, boost your sex performance, or help you at least to stay the way you should be and not decline?
Okay. So first off, as a healthcare professional, one of the things I love to do when I'm taking an approach to helping a patient resolve any clinical issue in order for me to have my desired clinical outcome, one of the things I like to do, I like to approach it non-pharmacologically, that's from the perspective of lifestyle and not initiate drug first. So when it comes to having a good sexual life, first off, it starts with your health, like generally. Sexual health is one thing that encompasses a lot, physically, mentally, financially, it's involved, right? So now, if you are fit, you should be able, as a normal person, enjoy your sexual life without inculcating or initiating sexual enhancers. Let's take, for example, a person is obese. By obese, I mean that your body fat is bigger than what the normal range, which is above 25. BMI, body mass index. If you're able to calculate that using your height and then your weight, you should be able to know if you are overweight, if you're underweight, if you're within weight range, or if you're obese. Now, for those people that are obese, definitely there's fat deposited somewhere. There is adipose tissue deposited somewhere. And then from medical practice, you would know that there's all a linkage: obesity, insulin resistance, diabetes, spike in blood sugar, glucose, and then, oxygen, transportation. And there's a lot of linkage. So now imagine someone is obese. First off, and you are thinking you're going to enjoy your sexual life, you will not enjoy your sexual life. One of the things you should do is to ensure that you are fit. By fit, I don't mean being slim, because you might be slim and you're underweight, you're not fit. But then ensure that your body mass index is within range, right? Exercise as much as you can. You mentioned your cardiovascular system. Your heart is of most importance. You cannot be consuming all the junks in this world and then you think that you'll be healthy. You will not. There's something called, the lining of fat in our hearts, vessels, our artery, our veins, and all of that. Then they can constrict blood flow. You have high blood pressure. You have increased blood pressure. You have hypertension. So first off, check out that you are fit. Exercise is one thing. Quit smoking. I don't think smoking has done anybody any good. And I'm speaking about this from the medical perspective of it. When you smoke, there's something called tar in the thing you smoke. And one of the things that tar or smoking has been responsible for is lung cancer. And that's like the second or third highest cancer in prevalence currently. And that's why we have more smoking cessation programs going on now.
Okay.
So for someone who smokes, you cannot enjoy your sexual life because there's a lot going on. You're introducing a lot. Free radicals going on here and there, cancer growth cells, we are proliferating a lot. So first of all, ensure that you are good. The hair you're taking in purified and you're not taking in a lot of, junks, your health, your exercise, your weight, and then ensure that good hygiene is also in a very chilled way. If you're relaxed, right? If you're not stressed, you're not having to shuttle between, this federal economy fuel is now 1,100 naira, you're shouting at the driver, you want to enter keke, you're already cursing somebody, by the time you want to go to the house, your blood pressure is already high. You're not able to enjoy it. So you're not thinking, your penis will rise. It will not rise now. You need to want to go and get a sexual enhancer. So that is, if you're able to avoid it, curtail all of this stress, curtail it, eat well, healthy. Do not consume fat-containing meals. Ensure that your weight is in check and all of that. And then be in a very peaceful relationship, because even toxic relationship, it has its own role to play.
Okay. So, you talk about toxic relationship because people don't look at the psychological aspect and the mental aspect of this. And there's something you said, you just brush through it, but it's something that I've been really fascinated over the last couple of years. the role that finances play when it comes to erectile dysfunction. It's something I'm looking at because it's, especially for the man,
Okay.
sometimes that there's out the worry of, where the next money for food is going to come from, that the urge is gone. You cannot function. I think that to a certain extent, it's something that the psychological aspect of it's becoming very increasing, especially in our today's society, with the pressure we're facing economic wise and people trying to make a living. So while you're trying to get yourself physically top notch and fit to do the sexual process, you also need to prepare yourself psychologically and mentally, because your mind is where everything starts. If you look at the process of erection, it first starts with the mind. That's why something has to stimulate you. Maybe what you're seeing, maybe what you're touching, maybe what somebody whispers to you, or sometimes even smell. There's how somebody will just have a particular perfume smell and just walk by.
True. Fragrance.
Yeah, sometimes it reminds you of that your eggs are almost finished here, but thank God you stood your ground. All right, so let's look at this, because you talked about some pleasure-based, enhancers. So I want to ask, because some people say that they use it for pleasure. Where does sex toys fit into all this?
Sex toys. By definition, what we call sex enhancers basically are either food or herbs that help with either sexual drive, maintaining, sustaining erection, and to help ejaculate and then pleasure. If I'm to place sex toys, I'll place them as pleasure-based because they're external stimulants. So you are having to apply it or use it externally. So it's basically you having to touch one or two places with these toys, and then the person gets aroused. Places that have more concentration of nerves. You have the clitoris, you have, behind the ears, you have some persons that are very funny. They even have here.
Yeah. That whole lot of...
There are pulse centers. There are a lot of places. So your ability to have those nerves stimulated again, it still boils down to the mechanism of action of these sex enhancers. The sex enhancers and the way they work. So we have the ones that are also responsible for neurotransmitters. So where you have your nerves, your nerve endings, and then the whole vibration that comes with it, and then signals, and then impulses, and all of that. So they kind of use that pathway. But now these ones are like external. So you are touching where there are nerve endings, and then you are stimulating the person. So I would classify them under the sexual pleasure aspect of it.
All right, because when you started and you were talking about that sexual enhancers, are what drug that people take and eat, and a whole lot of things, and the fact that it's something that helps with pleasure. I was scared you might not want to say that sexual enhancers, and I know so many people will argue that it gives them pleasure. And thank you, because ever since you've started this discussion, there's been emphasis on the fact that if anything is used, out of proportion, it still becomes a problem.
Sure.
Which these enhancers are one of such. So talk about safety. Okay, before you get into safety, let's look at possible side effects that may come with this.
Oh, okay. For the different classes, for the ones I talked about that help with libido, so we have serum testosterone, in play. For those ones, you probably likely have, increased hair growth, right? Something that's masculine, or voice. Your voice might become like way deeper. I'm sorry, I'm not throwing shit. I'm not throwing shit at you. But then
this one I carry come.
No, it's carry come. Okay. So you might have that. For some persons, they might just have fatigue. That's unexplained tiredness. And then we could also have flushes, more like warmth around like your face area because of blood, sometimes blood restriction, blood circulation, and all of that. Could also have people have sustained erection for a really long time, and it could be painful.
Okay.
It could be painful.
Okay, I think that's where things like priapism comes in.
Yes,
where
exactly.
Increased blood flow leads to destruction of blood vessels. And
Exactly. So you could have that as a possible side effect. Like I said again, side effects are things we expect to come. Like almost every drug has side effects. Adverse effects are the ones that happen in probably 1 in 10 persons, 1 in 100 persons. They are like really complicated. We do not think they would come, but if they come, they could happen in like 1 out of 10 persons. So priapism could likely be an adverse effect. It could be something that could even result in death, right? That's how bad it is. Some side effects are manageable. So for some persons, they might like want to tone down dose. For some persons, they might want to like withdraw completely. Again, do not do all of this without your healthcare professionals in play. You don't want to be messing around with your hormones. You don't want to be, today you are plugging in this hormone, today you are making testosterone coming on the scene, and then tomorrow you are doing the whole nitric oxide, and then tomorrow this other person is coming on scene. Your body, at some point, your body will be like, is this person having some breakdown? What's going on? So please do all of that in proportion and with the guidance of a healthcare professional.
No, okay, all right, because you know, when I look at people that do body lifting and do all this sport that has to do with body lifting, they use steroids, and sometimes you see the effect. And I think that's why if you look at people act more oftentimes. Like I talked about priapism, oftentimes because of the fact that they have to take enhancers, it destroys their blood vessels, and sometimes it could cause to, you know, curvature of the penis and the rest of the thing. So like you said, that's why you should take it according to what you are advised by your medical professional. It shouldn't be something that you have to go there and take it out for yourself.
Go to buy vitamin C 7, no, it has dosage range.
People don't know. But I feel that some people, that's right, vitamin C is something people should discuss, because they give children like sweet. A child is crying like, go collect vitamin C. So
it's candy.
Yeah, but basically it's like that. So,
and there's something else I want to add to that.
Oh.
For the ones that have to do with potency, that's the phosphoesterase inhibitors that have the nitric acid, nitric oxide in play, and then there's blood flow, then there's relaxation. It follows same pathway as some psychiatric and mental disorders. So for those people that abuse sexual enhancers, especially that woman that you want to sustain for 2 hours, I want you to just know, have that back of your mind, that it's the same pathway for psychiatry issues and mental disorder. So what this does is that over time, when a person becomes dependent on using this medication, you always observe that this person becomes anxious. The person becomes sweaty. If the person does not take it, the person is not fine. The person is not okay. And this issue of dependence is, in simple terms, is when a person does not have the ability to function without the use of certain substances. It happens to people that abuse drugs as well. They start behaving very funny. So for those people that are used to taking all of these sexual enhancers, on the long run, they'll start developing certain mental disorders, because you are not feeding that part of your brain or that part of you with what is needed to sustain balance and sanity. Because you are going to go and trigger what is supposed to do this. The same pathway, sexual pleasure, the same pathway, mental disorders. So if you now become dependent every time, what you're doing is that you're just telling me, come on, anxiety, come, depression, come, and all of that. So you're seeing a young guy that is already I see people now, you will do voice notes. Alpha guy, the girl don't come, they sweat. Yeah, my hand. You are all sweaty, you think it's not.
Could that be why when the lady disappoints, they look as if they want to run?
They want to, you see. You see, it's not until, you're walking, it's not until like, sometimes all these funny behaviors you exhibit when you're with a counterpart, you should be tracing them to how you abuse sexual enhancers. So in as much as you want to have pleasure, know that, like you said, when abuse comes into play, you might see you at the other side of life, and no apologies. All
right. So like Van Blessing would say, as the lady comes, or your counterpart comes and, is crazy over you, you should be careful about what you use, because in trying to be crazy over her, you might go the crazy road and, get actually crazy. But this is the reality we're seeing, and this is why we are having conversations like this, because these are conversations that people push under the carpet. These are things that have been peddled on the street every day. People are buying it. You walk around, you're checking people's pockets, you're going to be seeing this. And this is why here in the Intimate Matters podcast, we come to you, we bring knowledge such as this to you, and we discuss this with you so that you realize that your reproductive health matters, and it's another part of your body that you should actually take care of. So thank you so much for joining us on this episode of Intimate Matters podcast. And as always, I am Nosa Kwawokman, the one that is taking you on this ride. I'm the one that is anchoring this ship as we take a deep dive into the world of sexual and reproductive health. And in the Intimate Matters podcast, we believe that your intimacy matters. Thank you.